Welcome. Again, my name is Angie, and I am a registered nurse. I've been a nurse for over 20 years, and I've worked specifically with individuals with ALS and their families for over 10 years. Previously, before I worked at the ALS Association, I was a clinic coordinator and case manager for the ALS clinic at the Milwaukee VA in Wisconsin. So that's where I really gathered all of my tips and information, so it's coming from a credible source. So we're going to be talking today about nutrition and feeding tubes. So I want to take a moment to talk about, just gonna try to move, there we go, to talk about why is nutrition and eating affected with ALS? And it can be due to a multitude of things. So we'll go over that first. So nutrition and eating can be affected with weakened muscles. And the weakened muscles, it can make it difficult for a person to eat enough to meet your nutritional needs. Also, you might have difficulty with hand or limb coordination or weakness that might make it difficult to get the nutrition that you need. And also, if you're having weakness with your hands or your arms, it may increase the time required to prepare or eat your food. And as we know, we're all about conserving our energy and saving up that energy for things that you like to do. So it's really important for us to take the time and really look at why you might be having trouble not getting your nutritional needs. And then with the muscle weakness, it can affect the muscles that support chewing and swallowing. So chewing and swallowing food in or water fluids can become challenging. And there's also the risk of aspirating, and that's the fancy medical term for drawing foods or liquids down into your windpipe or your lungs. And this is especially important to note because it can lead to a very dangerous type of pneumonia called aspiration pneumonia. Another reason our nutritional needs might be not met is because of fatigue, constipation, or people with ALS often struggle from lack of appetite. And then with all of these things, whether you have difficulty chewing or swallowing, you might have weakness in your arms, any of these different reasons why you might not be getting your nutrition needs met will lead to weight loss. So it is extremely important to monitor your weight. I believe most of you go to an ALS clinic, and that definitely needs to be part of your visit, is getting your weight done. And I know standard clinics is about once every 3 months. If you're not getting weight, I would ask to make sure that they're getting your weight because that's very important to track. You can absolutely get your weight at home if you're able to safely stand. But I always caution you don't want to get obsessed with taking your weight, but you want to monitor it maybe once a week if you're not getting weight at clinic, or if you're noticing that you are losing weight, your clothes are looser, or your loved ones are saying, hey, I think, are you losing weight? Then you might want to start keeping a log. But again, you don't need to weigh yourself every day. Our human bodies fluctuate every hour, let alone every day. So taking it once a week, kind of at the same day, maybe once a week in the morning would be the best way to track it if you're wanting to track it for yourself. So dysphagia is the medical term for difficulty swallowing. And again, this is caused by weakening muscles in the mouth and then around the throat. And when you're having difficulty swallowing, those symptoms can look like coughing or choking on food or liquid as you're trying to swallow, a wet or gurgling sound in your voice immediately after swallowing food or liquid, difficulty chewing food. So food kind of spilling out of the mouth or liquid just spilling through the lips, an increase in your meal times with eating, the need for smaller bites or sips, and then difficulty managing saliva, Sometimes people with ALS will develop an increase of saliva, and then also shortness of breath during meals can all be reasons that your chewing and swallowing is affected. So we've talked about dysphagia, we've talked about, why you might be having difficulty with chewing, swallowing, getting your nutritional needs met. Well, what can you do? So there are things that your dietitian and the clinic team can help support you with to make sure that you are getting the nutrition that you need. So the number one person on your clinic team, whether you go to clinic or not, if you see a primary care provider or a neurologist not within the clinic team setting, they can all refer you to a dietitian if they're not part of your core team. But the dietitian's role is to monitor your weight and work with you along with a speech therapist to create a diet that not only meets your swallowing ability, but also your nutritional needs. So they'll work with modifying your diet and/or dietary supplements. No matter what, it's just always best to take small bites and small sips of liquids. It really reduces the risk of choking. If you begin coughing regularly when swallowing food or liquid, please reach out to your neurologist, because again, if you are noticing that coughing or that kind of gurgly wetness when you speak after you swallow some liquid or you eat, that could mean that that liquid or food is going down your windpipe into your lungs, and we don't want that to happen because it could cause pneumonia. So your speech therapist can help guide you with swallowing strategies. And then also there is evaluation, a video swallow study. I'm not seeing that offered as much as it used to be. I'd say like three or 4 years ago, because the dietitian and speech therapists in clinic have been really able to do a great job evaluating you while in clinic. So there isn't the need for this procedure to be done. But if it is ordered for you, just know that it is a way to evaluate when you swallow where that food or liquid is going. If it's going into your stomach where it belongs, or if it's going into your lungs. And when that study is done, then they can decide if you do require a special diet or restrictions. So just so I said, the dietitian and the speech therapist can really help with your actual diet and your swallowing guidelines. The occupational therapist is wonderful and can help you troubleshoot and provide adaptive equipment to help with feeding if you're having difficulty eating due to weakened muscles in your hands, arms, shoulders. So they are wonderful at helping troubleshoot and ordering different equipment for you. And we do have a lot of that adaptive equipment in our loan program. So please reach out to your care services manager or your connection that you have at the ALS Association before you would go and purchase anything. And of course, last but not least is feeding tube placement. So those are the different ways that the clinic team will assist you in managing your difficulty swallowing or getting your adequate nutrition. So as I said, this quickly just goes over the swallow study. It's, like I said, it's not done as often as it had been in previous years, but it's done under fluoroscopy. So they watch through x-ray what you eat or drink, and they can see exactly where it goes. And so if this were to be ordered for you, they'll go into detail on what to expect and those expectations. And I'm happy to answer more questions if you have some at the end. I want to preface before we kind of take a deep dive into feeding tubes that a feeding tube is seen as a quality of life measure, and that's how I'm going to talk to you all about it. I truly believe that a feeding tube is absolutely a personal choice, and as a medical professional, it's not up to us to lead you one direction over the other. I think it's our job to educate you about the pros and the cons of having one, not having one, and then letting each person decide. So please know Everyone approaches feeding tubes differently when it comes to their personal choice if they want one or not. And I'm just here to give you all the education and information I have. And again, at the end, I'm happy to answer questions. But I'm definitely not here to say, this is good, this is bad, you should do this, you shouldn't do this. I just really want you to feel informed and empowered. So if you do need to make the decision, you have all the information you need to do what's best for you. So many neurologists will talk to you about a feeding tube. You might hear it called a G tube or a PEG tube. And I'll kind of get into that a little bit more in the next slide about exactly the difference between those. But the neurologists you see might talk to you very early in your diagnosis, even if you are not having difficulty swallowing or meeting nutritional needs. And why is that? That is because it's becoming more common and actually best practice for patients to have a feeding tube placed prophylactically or in advance. And this is for several reasons. Having the tube placed sooner will lead to quicker healing and recovery. And part of your clinic visit, I'm sure you all have experienced the respiratory test, the pulmonary function test, where you get yelled at to blow, blow, blow. And that's so important because that's measuring your forced vital capacity of your lungs. And of course, this is important to track your progression and give you respiratory support if and when you need it. But it's also important because certain procedures will not be safe to do if your FVC is under a certain percentage. So usually it's 50%, but I bring that up to say that's one of the main reasons that a feeding tube is placed in advance, is either because someone's forced vital capacity is decreasing or going down, or there's a risk of respiratory complications during the procedure. So that's why if you do get it before you need it, especially when it comes to your breathing and lung capacity, you will have less complications, less risk for complications, and typically quicker healing and recovery compared to if you wait. And so, of course, having the tube placed prophylactically can improve quality of life and prevent future complications. But as I said before, it is ultimately your choice. So as I said, you might hear a feeding tube called the feeding tube. You might hear it called a G tube or a PEG tube. The G tube and the PEG tube are the two main types of feeding tubes that are permanent. And they are permanent as in they stay within your body, but of course they can be removed if needed. And they are the same type of tube. The difference between the G tube and the PEG tube is that they're in a different place in your body. And the PEG tube is most popular for individuals with ALS due to the placement of the PEG tube on the body. And typically there's actually less complications with a PEG tube compared to a G tube when it comes to individuals with ALS. That doesn't mean that if you get a G tube, you're going to have complications. It's just typically seen more with individuals with ALS that the PEG tube is the better option. But again, it all depends on your own personal anatomy. And a GI doctor, gastrointestinal physician, would be the one to determine that for you. And so usually with a feeding tube, your neurologist, of course, will have this conversation with you. And if you do go forward, he'll place a referral or a consult to a GI doctor who will then do an evaluation to make sure that you're safe and determine which feeding tube is appropriate for you and then schedule the procedure. So I want to touch quickly because I've been asked questions. Well, if I don't get a feeding tube, a G tube or a PEG tube, and I get to the point where I am not safe to have the procedure done and I can't chew and swallow, what do I do to get nutrition? So there is also a feeding tube called an NG tube or a nasogastric tube. And this one, it's external and it's not permanent, meaning it goes into your nose, down your esophagus and into your stomach. So this could be used to help give you fluids or formula to help with your nutrition, but it is not a long-term solution because it's extremely irritating on the back of the throat and the nose. So where this absolutely can be used if you need an option to get your nutrition and your fluids, just know that it's not a long-term solution. So there are many reasons why a feeding tube might be indicated for you for treatment, for quality of life. And it could be because of the weight loss that we've mentioned before, chewing, swallowing difficulties. Eating has become a burden. As I mentioned earlier, we're really about conserving your energy. And if it is just becoming so much effort and time for you to eat, and it's taking away the energy you could be used to doing something else you enjoy, then that might be a conversation that you'd like to have is, if you have a feeding tube, will that then free you up to do other things that you enjoy or that you want to do? Again, that increase in mealtime, fatigue after meals, just lack of appetite or interest in food. Again, that decline in respiratory function, and then helping to maintain and supplement your nutrition and hydration. And it's also an alternate route for medications. So it's also a great way to put medications if you can't swallow them or they taste gross. Like I know, unfortunately, Amylyx, Relivrio is found to be not effective and they're taking it off the market. But I know it had a horrific flavor. So for those who had a feeding tube, they were able to put it in the tube and not have to have that taste. So that's another kind of pro on why the feeding tube might be indicated. So we're going to talk about pros with the feeding tube. So if you see on the bottom right-hand side, that is a picture of a PEG tube, and that is the traditional tube. That is the tube that you will get when you have the procedure. There is another really great, they call it a low profile tube, and I'll get into that. That is even better, but this is the first thing that will be placed. So that's just kind of a picture for your own benefit, just to kind of understand what it might look like. So pros, it helps give you adequate intake of calories. So if you are having difficulty chewing or swallowing, or let's say you can chew or swallow, but you just aren't hungry and you can't get enough nutrition in through what you're eating, you can use that tube to supplement your fluids and your calories. It helps with protein and fluid weight stabilization. It decreases your risk of aspiration. And again, that's when you take in fluids or food down your windpipe and into your lungs. There's no choking, chewing, or swallowing problems if you're only utilizing that tube. It does improve quality of life for many reasons, from saving time and effort of trying to eat to reducing your risk of choking or swallowing. So we're keeping you home and safe. And then there's also many other reasons which we can get into. It's an easy way to get your medications. Your feeding times are simpler and shorter, and it saves your energy, like I said before, for other activities, which I think is very important for quality of life. And I also want to say what I think is a wonderful pro, which I don't think it's talked about enough, is that the feeding tube is absolutely what you make it. So there's no kind of status quo when it comes to the feeding tube. You can utilize it as a tool in whatever way you like, especially if you get it placed prior to really needing it. So let's say, we all hear, and I'm a nurse, I say it a lot, especially with ALS, fluids, fluids, fluids. Much easier said than done. And I know drinking water can get really boring. And it also might not be safe for you to be swallowing a lot of water. You can do water flushes with your tube, so that way you're getting your fluid. And actually, water and fluids are so important with ALS because they can actually decrease spasms, muscle spasms, and fasciculations. That's actually one of the main causes of muscle spasms and fasciculations is dehydration. So again, that's a great pro, to having the tube. You can use it to flush water. And then you can really use it any way you want. I have a lot of people who just love going out to eat with their friends. That is a quality of life measure for them. And you can absolutely still do that. And if there's certain things that are safe for you to eat, you can eat those things during your meal with your friends. And then when you go home, you can supplement with formula with your tube, really before or after. So it doesn't take away from that. I know culturally, most cultures, food is so important in bringing people together, that friendship, that community. So you can really utilize that tube to continue to help you still stay active with your friends and your family, but maybe not then worrying, how am I going to eat? How can I speak and eat? Because I'll be short of breath, those kinds of things. So you can still enjoy that time, knowing then that you can get your nutrition when you get home or do it beforehand. That's another great way to use it. Like I said, you can really use it any way you want to make it work for you. So I think that's definitely a pro. And you can talk to your dietitian about it, about how you can find a way to really make it work for you. And it's not one size fits all. It really can be used as a quality of life tool to really help you. And like I said earlier, I'm not here to persuade you one way or the other. I'm really here to give you all of the information, good and bad. So now we're going to just talk about the cons, because we talked about the pros. You are at risk, as you are for any type of procedure that's puncturing the skin for infection. So of course that needs to be noted. And the GI doctor and whoever is prepping you for the procedure will be going through all of that with you in detail, so you give truly informed consent before the procedure. After placement, the risk, you may have clogging. There could be infection at the feeding tube site. You might need to have the tube replaced emergently. The tube will need to be replaced every, I think, 6 to 9 months or so. And it's a quick outpatient procedure, but just to keep that in mind. And then there is daily care. If you get it placed prophylactically, the only thing you need to do is flush it twice a day. And I have to say, I have lots of individuals who tell me, like, Angie, I don't even do that. But I'm not saying you should do that because then you are at risk for it to become clogged. But it's as simple as just flushing it with water twice a day, to using it for medications, for fluids, for formula, for that nutrition supplementation. And then there could be intolerance to the feeding tube formula if you are using the formula. And just know there are so many different kinds of formula out there. There is organic, there's vegan, whatever allergy might have. And I just want to kind of put a spotlight on the fact that, just like many things, you might have to do some trial and error before you find a formula that's really beneficial to you and doesn't cause maybe bloating or diarrhea, those kinds of things. But you'll work really closely with your nutritionist, and they can put put fiber in it and multivitamins. I mean, there's so many different things. Or there's ones that you can buy, of course, that already have those things in there, but they'll work with you. So please don't get discouraged if you do have trouble initially with the feeding tube formula, if you're utilizing it, because there are so many different brands and kinds out there, and sometimes it just takes a while to find the one that's the most beneficial for you. And so, how is it used? There's a few different ways, and one way is with a syringe feeding. So on the bottom right hand side, you can see there's a hand with a can pouring the formula in the syringe, and then that syringe goes to the tube, and the tube goes then directly into the stomach. And so that is by gravity. When you're doing it that way, you never want to push things really fast because they're going directly into the stomach. But that is a way to do it. There's also a way to do it through gravity with an IV pole. And so instead of just pouring the formula into, or even water into that tube, the syringe, you can actually put it into a bag and hang it up on a pole, and then it's hooked through gravity, and then it just drips down and feeds through gravity. And then lastly, there are pump assisted feeding. So there are feeding tube pumps that are programmed, and they kind of do all that work for you. So there's different ways, and the dietitian will work with you on what's best for your lifestyle, and not only your lifestyle, your capacity. If you have limited range of motion, they'll work with you, or if you have a caregiver, spouse, loved one that's going to assist you. The decision is made together to see what would be the most supportive when it comes to the mechanics of flushing the tube, doing the feedings, and those kinds of things. These orders generally come from a home care agency, and insurance coverage does vary when it comes to different formula and things like that. But your dietitian and the home care agency will work together to make sure they can get you what's covered, whether you're on Medicare, Medicaid, or private insurance. So I said a little bit ago, I said there was one tube that really even allows for more quality of life. And I love to sing the praises of this tube. It's called a low profile tube because unlike the one I showed you first that everyone always gets placed, because they do have that maybe about 6-inch tubing that comes out, this is low profile, and it's called the Mickey button. And why is it so fabulous? Well, it's less prone to get dislodged, and it's not going to get as clogged or get occluded because there's less of a tube. And it has a cap and go option, which is great. There's a no-show. So just as I showed before, that about 6-inch tube, again, you can absolutely hide that under clothes, but this one, again, low profile, which is great. And the big difference, and I like to really recommend this, especially for people who are still active or enjoy activities and are able to do them, whether it be bike riding, swimming, or being submerged in water, running, any kind of activity where there's movement, or if you're submerged, the Mickey button is wonderful. The big difference between this Mickey button and the general tube is that the general tube, you cannot be submerged in water. Showers are fine, but if you take a bath, you'd have to make sure that the tube was above the water line. I don't know many people with ALS who are still getting in and out of hot tubs, but if you are approved by your neurologist to safely do that, you can go into the hot tub with the Mickey button. And as I said, it's beneficial for sports and activities. So why do they place that longer tube, the high profile tube, at first? That's to make sure that your body takes to the tube and everything heals before you get the Mickey button. So if you have no complications and you heal nicely, no infections and things, you can usually get the Mickey button switched, or I should say you could get your tube that was originally placed and switched to the Mickey button at about 3 months. I've seen 6 months. It's usually 6 months if you've had complications. I've had many patients who have just stayed with that longer tube and they have no issues. But like I said, especially if you're active, or you enjoy taking baths, or you take baths or swim or go in the ocean, I would highly recommend switching to the Mickey button when you're cleared by your GI doctor to do that. Oh, and before I get into this, there's one more thing I like to say, and it's a pro. I will not be the one to say I recommend putting alcohol through your feeding tube, but we do live in the Midwest, and I know in Wisconsin, people love their beer and old fashions. I'm sure it's pretty similar in Minnesota and our other Midwest states. So just know you can put alcohol in the Mickey button in the feeding tube. It needs to be diluted with water before it goes in, because first of all, it can be very rough and almost toxic to your stomach lining if it's straight alcohol, because it's not getting diluted as it goes down. But then also, if you're putting alcohol directly into the stomach, there's a chance it's going to cause you could get drunk quite quickly, I guess is what I'll say. So you really want to be able to dilute it like half water, half wine, half water, half drink. But just as a pro, you absolutely can put alcohol in the feeding tube. So the Oli Foundation is a wonderful foundation that supports anyone with a feeding tube or IV, any kind of external nutrition, and they help with advocacy, education, community, innovation. They have different grants and things too, and really great resources and information. And so you'll all get this slide in this direct link to their website so you can look more into it. But it's the best foundation out there when it comes to feeding tubes and resources and information. And then I quickly want to touch on traveling and flying. You can absolutely, if you're a traveler, whether you travel by camper van or airplane, you can absolutely travel with a feeding tube, and you can do it effectively. It takes some planning ahead, but as long as you put in the effort beforehand, you can still have a fabulous time with your travels and your adventuring with your feeding tube. The number one tip is always talk to your doctor before you go anywhere, because they can assist in a letter, which you would need to bring on if you're bringing it on the airplane to get you through airport security and that kind of thing. You know, we always say that you want to take your feeding tube through the security, but you have it in a separate bag. And you know, I'm happy to go over this in more detail if any of you are planning to travel. Your dietitian should be up to date on these types of tips as well. But some other tips, book direct whenever possible if you are flying. Taking a direct flight to your destination can help you avoid airport delays and long connections that can potentially make feeding difficult. And then you want to make a list. Like I said, if you really put in the effort to be prepared for your trip, you can have a fabulous time. And it's really like any trip. You have to put in some effort to make sure that it goes as smoothly as possible. Because as we all know, especially nowadays, flying and delays and cancellations of flights happens pretty frequently. So the more prepared you are, the better. So it's great to have a running list of the essentials, like the formula, the feeding tube, syringes, tape, containers or bags, your pump if you use one, medications, those kinds of things. And it's great if you keep your list, you know, with everything, so then you can, you know, cross-reference, okay, I got this, I got that. I think it's really helpful. Another tip is finding appropriate accommodations. When you travel, you should opt for hotels that can provide either an in-room refrigerator, allow you to use their kitchen refrigerator, or call ahead. And if the rooms don't come with refrigerators, a lot of hotels, if you call ahead of time, have mini fridges on kind of standby, but they go pretty quickly. So you kind of have to reserve one, and they'll physically put it in the room for you before you arrive or after you arrive. Feeding tube formula does not have to be refrigerated until it's opened. But yeah, so that's why their refrigerator is important. And then consider shipping your supplies ahead of time instead of packing them. Depending on how long you'll be at your destination, it may be helpful to ask your home care company if they can ship supplies to your destination in advance. Then it makes your luggage lighter, and then you don't have to spend your precious vacation time trying to track down your necessities. And then I know you don't hear this very often with TSA, but TSA Cares has a phenomenal, that's a department within the TSA that provides direct support for people who have any kind of medical need or need assistance getting through the airport, those kinds of things. They're phenomenal. That's why I said you don't hear this much about the TSA being told that they're phenomenal, but TSA Cares is. And so I highly, highly suggest, whether you get a feeding tube and you travel or you don't, if you're going to be traveling via air, I would absolutely recommend contacting them. And you can do that via online or there's a phone number on their website as well. But they can help you with from the second you arrive to the airport to helping you get on the plane. They'll be there for you the second you get off, and they'll even get you right to accessible bathrooms. I mean, they're wonderful. And actually, the program, when it initiated a few years ago, was piloted in O'Hare in Chicago, so kind of in our area. So they do a wonderful job. So I highly recommend TSA Cares for any travel needs that you might have. And then, of course, create an emergency plan, compiling a document with all of your health information, contracts in the name of a local hospital, sharing it with your travel companions. That helps, just kind of lets you have your peace of mind. And then, as I said in the previous slides, with being prepared and packing those essentials and packing them on your carry-on, because as we know, luggage does get lost if you check it. And you don't want to be at your destination and you checked your essentials that you need and your bag is missing, because then how do you eat? You know, how are you getting your nutrition? So you really want to get all your essentials and bring them in a carry-on bag, so then you have what you need just in case there's a delay with the plane or you have trouble getting your luggage back to you. And then, of course, allow for lots of extra time. So building excess time into your schedule can help reduce worry and stress, especially when you're flying. For instance, airport security may need additional time to examine the equipment, supplies, your feeding device. So just build in that extra time so you don't have that stress of not making it to your gate in time. All right, a few more, and then we'll wrap up. So jet lag could make it difficult to stick to your usual feeding schedule. So you can slowly adjust your body's circadian rhythm to your destination time zone by waking up and feeding an hour earlier or later every day, starting about a week before your trip. So again, you can kind of plan ahead with that as well to start getting your body ready for a new time zone if you're traveling internationally, especially. If it's your first visit with your family or friends with your feeding tube, it may be easiest to start with an open approach by explaining what a feeding tube is, how it works, and how you're most comfortable feeding. If you'd like to eat with a group, go ahead and say so. However, if you prefer to use your feeding tube in the privacy of your room, that's absolutely okay too. So if feeding in public places makes you self-conscious, there are many museums, amusement parks, and airports that have breastfeeding or quiet rooms that you can use. If you're going to a restaurant, you can call ahead and ask if there's a private dining room or alcove that you can sneak off to. Just don't use the bathroom. They're filled with germs, so definitely stay out of the bathroom to do your feedings. And feeling rushed. Tube feeding nutrition can take time and preparation, so let your fellow travelers know in advance that you'll need just a little extra time to pack supplies or to clean equipment. And if dehydration is a concern, if you're spending hours in the air or traveling somewhere hot, you want to stay hydrated by infusing small amounts of water through your feeding tube frequently throughout the day.